Okay, so good day everyone. My name is Ivan A. Costales from BSN1C, and today I'm going to assess my patient's thorax and lungs. So the first thing that we need to do is instruct the client, explain the assessment or the process to the patient, and secure verbal consent. And the next one is explain that you will be touching the client in various area with different parts of your hand and report if pain or discomfort is felt. And next, provide privacy or warmth and well-lit room. And for the subjective data, ask the patient for the current health status, SOB, DOB, or cyanosis, and cough, sputum, and chest pain. And ask the patient or evaluate the patient for the past health status like lungs disease, exposure or allergies, and smoking if he or she is smoking, and medication use of oxygen or vaccinations. Okay, sir. So, ask ko lang po if naninigarilyo po ba kayo? Or what? May sumasakit po ba sa dibdib mo? Relax. Or may tinitake po ba kayong any medications? Wala mo. So, next, let's inspect for the thorax, the anterior thorax. So the first thing that we need to do is to position our client into a comfortable position, and the patient should be sitting position with clothing removed and except for an examination gown or drape. And next, inspect for the clients to breathe normally. Okay. So sir, hinga lang po kayo ng normal. Kung paano mo gagawin. Ano po? Then, observe for the skin color. Um, Pink undertones indicate normal oxygenation, and skin color should be consistent with that of the rest of the body, like lips and nail beds. Okay, sir. Diretso sa akin. Okay. Magpakita ko ng mga po. Okay. So the next one is inspect the structures of the thorax, slope of ribs, and symmetry. The clavicles should be at the same height, and the sternum should be in the midline of the body, and the coastal angle should be less than 90 degrees. Okay, sir. So, diretso sa ako. Okay. So after that, look for the structures of the chest, and the chest movement should be symmetrical. So, thank you. And for the next one, observe the muscles and the chest and the neck, and including the abdominal retraction or substernal, intercostal, and suprasternal, and the use of accessories like sternocleidomastoids. And the next one is inspect the chest for configuration and shape. So the next one is unique, and the next one that we're going to do is to count the respiration or respiratory rate and observe depth and the rhythm. Okay. So here we are going to use watch or any clock that you may use in your house. Okay. So the first thing that we need to do is count the number of respiratory cycles per minute or beats per minute. And do not tell the client that you are counting the respirations because it may alter the normal breathing pattern. Sir, nahihirapan po ba kayong huminga? Wala naman po bang sumasakit or what? So, in counting the respiratory rate of our patient, you can use the way like count the respiratory rate of the patient into like 30 seconds, then the result multiply it by 2. So you'll get the 1 minute respiratory rate of our patient. And next, respiration should be even and smooth. And for males, they tend to breathe abdominally or diaphragmatically. And for the females, they breathe more costally or thoracically. So next, let's palpate the anterior thorax. Palpate areas of tenderness, lesions, masses, or crepitation on the sternum, ribs, and the intercostal spaces. And make sure to palpate downward to the sternal angle. So next, lightly palpate the anterior thorax. Use the finger pads and include the entire thorax by starting at the areas above each clavicle and move from the side to side or to below the costal angle and laterally to the mid-axillary line. Mid-axillary line. Dito po siya. Okay. Palpation for thoracic expansion. So first, place your hands on the lower chest and asking the client to take a breath. And place the palmar surface of your hands along each costal margin with thumbs close to the mid-sternal line. And pinch up some skin between your thumbs. Sir, hinga po kayo, sir. Okay, sir. Thank you po. Okay, for the next one, palpate for tactile fremitus. In this, feel for vibrations on the chest wall while the client speaks 99 or 1 to 3 on a clear, loud voice. And in this, use the palmar surface of the hand to feel the vibration. And palpate and compare the symmetrical areas of the lungs by moving from side to side from apices to bases. Okay. So, sir. Say 99, sir, kapag naramdaman niyo na pong nila.
99. 99. 99. 99. 99. 99. 99.
Yes, sir.
99.
Okay, sir. Thank you. Okay, so the next one is percussion of the anterior thorax. So here, begin at the apices of the lungs and ask the client to turn the head to the opposite side of percussion to increase the size of the surface required for placing your fingers, the middle finger and the index finger, and to avoid interference from the clavicle. And move the chest wall and place the fingers in the intercostal space parallel to the ribs. And during percussion, percuss the anterior chest from side to side. And comparing sounds in the intercostal spaces, percuss the bases and laterally to the mid-axillary line. Okay, sir. So, sir, medyo i-side ko lang po. Sir, dito na po po sa side. Okay, so next po. Yes, sir. Yes, sir. So next is auscultation of the anterior thorax. So here, in this auscultation, we are going to use stethoscope and ask the client to breathe deeply through the mouth each time that the stethoscope is placed on the chest. And place the stethoscope over the trachea above the suprasternal or suprasternal notch to hear bronchial sounds or bronchial breath sounds. And make sure to use the diaphragm side of the stethoscope. Okay, sir. Hinga lang po kayo ng malalim pag kailangan ko lang po ng sa inyo. Okay, so next is the assessment of the voice sound. Okay, in this assessment, the client will remain in the same position as the percussion and the auscultation. And explain that you will be listening to the chest while the client says certain words, letters, or numbers. And in auscultation of voice sounds, use the same pattern for evaluating the voice sounds as far as auscultation of the lungs. So here, there's two ways to test it. First is the bronchophony. Ask the client to say 99, and each time you place the stethoscope on the chest, and in the normal lung tissue, the sound will be muffled. And here we are going to use stethoscope. So, say 99 lang po, sir.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And next, for the egophony or egophony. Ask the client to say E each time you place the stethoscope on the chest. And in normal lung tissue, you should hear E through the stethoscope. Okay. So next, sir, pakisabi po na E. Every time na itatouch ko yung stethoscope.
E, 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 E.
Thank you po. Next, the percussion of the posterior thorax. So first is visualize the landmarks. Observe for the posterior thorax and visualize the horizontal and vertical lines. And explain to the client that you will be tapping on the client in a variety of areas. And ask the patient also to um, look in front of where you are looking so that you can see his mouth. Okay. So, sorry, tatap ko na po. Okay, sir. Thank you po. Okay, so the next one, precast for movement of the diaphragmatic excursion. This assessment requires the use of skin marker and ruler. So here, explain to the client that you will be doing more tapping on the chest and the 2 points. You will ask the client to exhale and inhale. So determine the level of the diaphragm during the quest respirations by placing the finger above the expected level of diaphragmatic dullness, or 17 or 18 at the mid-scapular line. Okay, sir. So, sir, pwede po bang yung mag-exhale muna at i-hold lang po muna yung hininga? Okay, sir. Tatap ko lang po. Okay. So, if you already find the first point, mark it with the skin marker. Okay, sir. Okay. And next, ask the patient to inhale and hold his or her breath. Okay, sir. So, inhale na po kayo, sir. Then, i-hold nyo muna po yung YouTube. And stop until you hear hollow sounds. Okay, so here. After marking the first and the second, use the ruler to measure the distance between the marks. And it should be at least 3 to 5 centimeters. Okay. Okay, sir. Thank you. Okay, so for the next one, auscultation of the posterior thorax. So ask the client to breathe deeply through the mouth each time the stethoscope is placed on a new spot, and tell the client to let you know if he or she becoming tired or short of breath, and this and If so, you will stop and allow time to rest. And first, visualize the landmarks as you did before percussing the posterior thorax. Uh, so here we're going to use our stethoscope. Okay, sir. Um, hinga lang po kayo ng malalim pag i-breathe ko. 1, 2, 3, 4. So, so for the last one is the interpretation and documentation of findings. Refer the descriptions and interpretations of normal and adventitious breath, sounds, and for the data and for the documenting, document the date and the time, procedure done, and for the findings, and if the findings is with abnormal findings or actions taken, and the patient's response to the intervention. So that's all.